Welcome to the Chime Opioid Action Center podcast, where healthcare leaders explore how technology is making an impact in the fight to end the opioid crisis. Here's today's moderator.
Welcome, and thank you for joining us for this episode of the Chime Opioid Action Center podcast. I'm Janet DeRoche, a member and committee co-chair for the Chime Opioid Task Force, and I'll be your moderator for today. Today's guest is Kelsey Sharda. Kelsey is a clinical program manager with Avera Behavioral Health in the Link in Sioux Falls, South Dakota. Kelsey's been with Avera for over 12 years and oversees their partial hospitalization program as well as operations at the Link being a community triage center for people experiencing a behavioral health crisis or needing care for substance abuse disorder. Welcome, Kelsey, and thank you for sharing your experiences and learnings.
Thank you for having me.
Kelsey, please share with us your story, the setting of Sioux Falls, Avera Health, and the Link.
Yeah, so like Janet mentioned, I'm one of our program managers for Avera here in Sioux Falls. Sioux Falls is located in the southeast corner of South Dakota. We're the biggest city within the state, and we make up about 30% of the state's population. We're a growing and diverse community. We're located about 30 miles between Iowa and Minnesota border, so we also get a lot of folks into our community from those surrounding rural areas. Avera itself is an integrated Catholic health system. We have over 300 locations and 100 communities across our 5-state area, and we have 6 regional centers and serve a population of nearly 1 million people. Because of our growing community here in Sioux Falls, and we are seeing a need for increased mental health and addiction services, the Link was born. So we've been open for over 3 years now, and the Link is a community triage center located right in downtown Sioux Falls. It's comprised of 4 main partners, which include the city of Sioux Falls itself, Minnehaha County, which is the biggest county that Sioux Falls is located in, and then our 2 main health systems, Sanford and Avera, which are within our city here.
Thanks, Kelsey. I know that not only are you a compassionate caregiver, but you're also data-driven and have used a lot of the data that was available to you to make the case for the Link and to do the outreach to the community. Mm-hmm. Can you speak to that in a little bit more detail in terms of how you use the data to make the case for the Link?
Yeah, so although the Link's been open 3 years, it really started numerous years before that. And part of that was a project team being developed. And one of those components on the team was actually a research team from our University of South Dakota here. They assisted with collecting a lot of the baseline data about our community, about the needs that we're seeing, to really help paint the picture of why we need a place like the Link. It was also vital in getting leadership on board. It's very rare to have entities like ours come together for a cause and support that. They do make up the operation of the Link and our budget. And so it really showed how to invest in places like the Link and how that really gives the community a return on what they're seeing.
Excellent. I was also very interested in hearing how you used your community health needs assessment, which we know every non-for-profit organization has to produce and make publicly available every 3 years. Tell us more about how you used your CHNA and how others might be able to use the data that's in the Community Health Needs Assessment.
So a community assessment was done a few years prior to the Link's opening, which really started, again, the conversation regarding gaps in services that we're seeing in the community. And they tend to identify like 3 main target areas, and one of those being addiction and mental health services. So through this conversation, the idea of bringing a community triage center to our area was born. The individuals who sit in on these discussions are various stakeholders through different businesses and entities throughout the community, as well as consumers. So it's a very diverse group of folks, and they really bring to the table what they're seeing in their areas.
Excellent. So by definition, the CHNA does bring community members together. That's part of what the goal is. But I know when I have listened to your story before, you've talked in a very compelling manner about those partnerships with the community. Can you elaborate further on how you forge those partnerships and the value of those partnerships as it relates to the Link?
Yeah, the Link would not exist if we didn't have our community partners. So although Avera runs the operations of the Link, it's really seen as a community project. So I've mentioned kind of those initial project teams or work groups. They really formed the idea throughout the needs assessment. And so that was made up of a diverse group of folks too. So there were representatives from the county, government, our public health arena, research, addiction specialists, law enforcement was also a huge player in that. And so those folks really kind of birthed this in a way. They went to different sites across the country to tour different models. So community triage centers are becoming more popular now, but 5-6 years ago, it was still a pretty new thing. And so they went to a few different locations, kind of tailored that to what would work for our community based upon what the partners need. And so I think that is vital. And so they spent a lot of time researching, like I mentioned, the different models. And now that the link is here and we're operating, we still go back to some of those same partners and really talk about, okay, what's working, what's not working. We get those opinions and feedback from what they hear from their folks that are on the ground experiencing things. And so the partnerships are just huge. I can't speak enough about that.
So Kelsey, kind of tying the partnerships and the metrics and the impact together, I've heard you talk about some real life stories in terms of the impact you're having to patients who would otherwise have gone to the ED or would have been interacting with law enforcement. Where did you see some of those stories and some of the benefits of serving the people through the link that would improve or even reduce the number of interactions with some of those other community members like law enforcement and the emergency departments?
Yeah, so before the link opened, people really had, well, 3 choices, but one of was to go to the emergency department if they were in need of emergency services related to their addiction. So, for example, wanting to withdraw or acutely intoxicated and not having somewhere safe to be. The second option was to essentially be booked into jail under a protective custody hold. And then the third was we did have, prior to the link's opening, a withdrawal center, but it was operated out of the jail. And it was only considered a social detox. So there was no nursing staff, no medications to help folks through the withdrawal process. And so it really wasn't utilized by anybody voluntarily in the community. It was mostly utilized only for those folks who had some type of legal involvement or an involuntary commitment is what our state calls it for folks. And so those were kind of the 3 main options. And so since the link's opening, we have diverted all of those visits to the link. So we're providing that right care at the right time and in the right setting to folks. So they are out of our jails, they're out of our emergency departments. So it's really huge for not only the patient's care, but for our community partners as well.
That's awesome. And I'm sure I know you have the numbers to support that results in better recovery rates and getting patients into the right services. We talk a lot on our committee about stigma, and I know you've talked about that too. Can you please elaborate on your experience with stigma and the role of the link and how those things have kind of converged?
Yeah. So although I think society is making strides in removing some of the stigma associated with mental health and addiction, it's still a barrier for folks. At the link, we've worked hard on providing a lot of education within our community on addiction and what the link does. We often find that when you share people's stories, it allows others to share their own story or the story of someone else close to them. Addiction and mental health impacts us all. So it might be something we struggle with even ourselves. So talking about it, educating others, telling stories of success. I think that's a big one too, because with addiction, people take multiple times entering treatment to really have ongoing success. And so sometimes it can seem pretty defeated feeling for folks. And so trying to tell those stories of success, those are the ways we've found to kind of do our part with helping reduce that stigma.
That's so important. So Kelsey, one of the other things you talk a lot about, and you saw in the data, is the diversity of your population and the importance of addressing cultural norms and sensitivities and treating everyone with dignity. Maybe you can share some specific experiences with us and some of the important ways in which you recognize and adjust how you do things based on people's backgrounds.
Yeah, so in Sioux Falls, our population is about 80% white, and the American Indian population here accounts for just about 2% of our city's makeup. Yet at the link, we serve, our folks we serve identify as American Indian about 60% of the time. And so it's a huge portion of the individuals we serve. And so we've tried to be mindful of that. We've partnered with Urban Indian Health here in our area. And so we have sought them out to provide cultural sensitivity training to our staff here at the link. They also have partnered with us to do some of programming within our units to offer talking circles, saging with folks, just things that really help meet the needs of those we're serving. And so I think that has been very well received. So almost 50% of the individuals we serve at the link are unsheltered. So we are serving individuals who often don't have health insurance, unhoused, struggling with addiction and mental health issues. So a very vulnerable set of individuals within our community. And so we try to be really sensitive to those needs and really provide resources, help connect them to what they need. It could be getting an ID so they can go out and look for housing. We really have to get creative with meeting their basic needs.
That's great. I think I might jump around a little bit here because I think it would be appropriate to have you speak a little bit about some of the key outcomes and measures that you've seen in terms of improvement in the patient population and what metrics you're actually tracking for the link in the patients.
Yeah, we have a lot of great data on the work the link is doing, so I'll highlight some of it. So prior to the link's opening, our jail here in Sioux Falls would see over 200 bookings a month on folks brought in on those protective custody holds. So again, those are those holds that the law enforcement can place on folks who are acutely intoxicated. Since the link's opening, that number tends to hover around 15 a month that are actually booked into jail. So that's a huge reduction for our law enforcement partners. Also, when they bring somebody into the link, they are in and out under 15 minutes. And so previously they would have to go to the emergency department where they might spend hours there with an individual. So we're getting officers turned around back on the street and in service. Of the individuals brought into the link, almost 50% of them would say that if the link didn't exist, they would not have sought services. So by being there, by being available, we are catching more people. Now that we've been open a few years, we are busier than ever. Since our opening. And so people are starting to know about us, not just maybe our core folks that we tend to see frequently throughout the facility. We're attracting other individuals, which is neat that we have that presence in the community that, others might feel good about bringing in their own mom to receive care there.
I know you had mentioned also you've seen the reduction in emergency department visits and a comfort level so that if folks are having recurrent problems, they're more comfortable going to the link. And then you have a process by which you refer them out to other services, right? So for like an addiction patient, you might triage, stabilize, and then refer them out to other services.
Yeah, you're exactly right. So if one of our 3 programs, which I can tell you a little more about, does not meet the need of the individual, we do our best to really connect them to that next best thing. And so one of our programs is our sobering program. So this service allows individuals who are acutely intoxicated a safe place to be. So these individuals often come to us by law enforcement, but not always. We do accept walk-ins. So instead of, again, bringing them to the jail, they can come to the link and stay with us for a few hours to sober up. Our second program is our withdrawal management program. So we provide medically managed withdrawal to individuals. We're staffed 24/7 with nursing care. We have an APP that rounds on individuals daily while they're in our program. Our other staff members include behavioral health techs, chemical dependency counselor, peer support. And then our third program is crisis stabilization. So this program is for individuals who are experiencing an acute mental health crisis. They can stay with us in observation up to 23 hours. So if somebody walks in and one of those programs is not what they need, like I mentioned, then we'll do our best to really connect them and provide that warm handoff.
And are you, you had mentioned that you do start some treatment. Will you refer out for the medication assisted treatment for the substance use and opioid use disorder?
Yeah, good question. We can initiate that if individuals do come into us. And then after their stay in our withdrawal program, which averages like 3 to 5 days, then we are referring them back out to community partners for that ongoing care.
I know, Kelsey, we haven't talked about this in great detail, but perhaps you can talk a little bit about funding and what some of the challenges are around that, and maybe even some advice you can give to others that might be thinking of establishing something like the link in their community.
Yeah, funding is always kind of the hot topic. The link is made up of those 4 main partners, like I mentioned. So the city of Sioux Falls, Minnehaha County, Avera, and Sanford Health. So those 4 partners actually contribute dollars every year to cover the expenses of the link. So really unique, again, that 4 different entities are all behind, one mission, one service and they're putting dollars up to support that. And so they cover our operations. We also receive some dollars from the state to cover individuals' care who meet the poverty guidelines. And so we do get a little bit of dollars that way. We are CARF accredited for our withdrawal management program, so we can bill insurance if folks have it. But like I mentioned, about over 60% of the folks who come to us do not have health insurance or any form of payment. And so as part of the mission of the link, it was really important to the partners that folks don't come into the link and receive bills. And so if individuals do not have insurance, do not have means to pay, they do not receive a bill for services. And so that's also a really neat component of the link that not a lot of other programs can do or say. And so, but it does come with challenges. So the funding is something we're always trying to look at. What opportunities might exist for grants? Are there other partners who maybe support the mission of the link that want to come on board? That's another avenue for things. Partnering with maybe community mental health centers. That's what we call them here in South Dakota. So they receive a lot of the state funded dollars. And so depending upon where you're located and what the structure is in your state, is there opportunities to partner there to receive some of those block dollars. So I think getting creative, looking for other opportunities for dollars. Are there grants that are available that support the work you're doing, or if there's a new program you want to get up and going? Also looking for other partners that might exist within the community that support the mission, that maybe want to be a part of the work you are doing. And lastly, maybe community mental health partners that might exist in your state. So here in South Dakota, each of our regions has a community mental health designated facility, and so they're able to receive some state dollars that other entities cannot. And so maybe there's a partnership there that you can leverage to help bring in dollars for the similar programs you are doing.
Yeah, and Kelsey, I know because I've seen what you've done is that you have some very compelling data. So from a technology perspective, I know you're using some basic EHR functionality, but when it comes to analytics and really using the data, I think folks would be impressed with what you can show in terms of, assessing the community, showing your outcomes, and that factors in huge when you're out there looking for grants or when you're trying to forge new partnerships, that you can show hard and fast data to support your case. So congratulations on the phenomenal job you've done with that.
Thank you. Yeah, absolutely. The people who invest in it want to see their return on the dollar. What is this benefiting not only their personal organization, but the community, the partners. And so that has been a huge point for us, is to really collect all of the data we can. And we're fortunate that we do have the research partners through the University of South Dakota who also help with organizing some of that for us and bringing that picture back to our stakeholders.
Excellent. Kelsey, what is your vision for the future? And also, if there is advice or, lessons learned from your own experience that would be beneficial to our audience?
Yeah, we have proven the concept, and now it really comes down to perfecting the structure. So we're continuing to focus on data collection to show the value of the link, streamline our processes. We're looking for alternative funding, reimbursement opportunities. Again, how can we get creative ourselves? One example is in the last month, our own community mental health center actually moved some of its staff into the link. And so we've partnered with them to, they're providing some of their own services in our building. They're helping with our own program, connecting folks to the services they offer, because again, a lot of times we're already serving the same folks. So we're trying to bring as many community partners under one roof as we can to catch some of these individuals. And so for lessons learned, I think just do what works for your community. Find out what the needs are, get individuals together, talk about those gaps. Maybe how can you approach the same problems, but from a new perspective. And if you've seen one triage center, you've just seen one. There's so many different approaches out there, communities that do things just a little bit different. And so kind of talk with them. I know at the link we have met with different organizations who have been intrigued or want to ask questions about our structure. And so I would be open to anybody who's interested in that as well, if you want to reach out to find out more.
That's great. Thank you. Thank you so much for not only the impact you're having, but your willingness to work with others. Are there any final thoughts or experiences that you might want to share with our audience as we wrap up?
Well, one of the stories I tell often, because it's just a notable success story, and I think a good one we can end this conversation on, is about a gentleman we've worked with. So once the link opened, he was into us multiple times into our sobering program, over 20 times. In our withdrawal management program, he had come to us 4 times, had multiple visits to our emergency department, numerous hospital stays, encounters with law enforcement. The list kind of goes on. And so he kept coming in, we kept offering services. And after 3 months, he finally made the commitment to seek treatment. And so you just never know when that one time is going to be. So communities really need services where they meet individuals where they're at in their time of need. And when it finally happens where they make the commitment, it's a beautiful thing you get to be a part of. So I like to say the link is planting seeds with each visit. It's kind of seeds of hope, and then eventually it grows.
Thank you for sharing that story. You're such an inspiration, and I'm sure you love seeing some of these people turn the corner after all your hard work and dedication. So I want to thank you, Kelsey, for your time and your insights, and again, for being so inspiring in what you do. And I want to thank our audience for listening to the Chime Opioid Action Center podcast, and remind you that you can visit the opioidactioncenter.com for this and other episodes. So take care and be safe. And thank you again, Kelsey, for joining us.
Thank you.